Minister Dr. Joe Phaahla this afternoon visiting the victims of the Johannesburg Fire incident, which has killed 74 people. Now, some of them are being treated at the Helen Joseph Academic Hospital. The minister is being accompanied by senior officials from both national and provincial health departments. Moloko Moloto is tracking that visit currently for us, joining us now live from the Helen Joseph Hospital. Moloko, good afternoon again. We understand in the last hour or so the minister is in the hospital, currently meeting with the hospital officials to get an update.
Well, indeed, Braden, the minister arrived, we understand, an hour ago, actually, when we were on air with you. We were told that his motorcade drove into the hospital. We haven't been able to speak to him yet because he's still in an internal briefing with the officials of this hospital, as well as the team of the officials from the Gauteng provincial government, led by MEC Nomantu Nkomorale-Hoko, who obviously is the one responsible for health. And obviously this particular hospital being one of the health facilities here in Gauteng, where the victims of that fire are being treated at, is obviously this is where the attention is at. And up to now, we don't know whether they will be able to give us an opportunity to go with the minister on a walkabout, because we understand that those who came here, Braden, were in a critical condition in the intensive care unit. So I suppose if that is the case, it would really make sense not to allow the cameras in there because of the state that they would have been. But we're just waiting to hear from the minister. An alternative from the officials was that if they don't allow us in, the minister will then go and do a walkabout and then come out to brief us about their state as to whether they are recuperating or not.
Yeah, so it's going to be a very interesting one, because if they are in the ICU, as we heard yesterday here on yesterday afternoon from the CEO while briefing the media, that the 6 seriously injured people from the fire are being kept or have been admitted to the ICU. I guess we won't be able to see any of the patients, and we'll have to look forward to the briefing. Any idea, Moloko, at this stage about their condition?
I really wouldn't know much, Braden. The difficulty is that we are not able to tell whether they are recovering or not, because another thing is that it is just a bit difficult to even get hold of their families. Many of them, the people who are staying in that particular 5-story building, we understand, are foreign nationals, and that is just adding to the whole layer of complexities when it comes to identifying them. You will also understand that some of their documents potentially burned down in that inferno, and it will be a very difficult problem. Majority of those who unfortunately perished were bent beyond recognition. So the process of identifying them, the deceased, will certainly take long, very long. And I'm not too sure at this point in time, and this is a question that we will pose to the minister, to say, those who are in the hospitals, over 50 of them, initially that is the number that had been admitted. We will want to know, obviously, in terms of the total number of those who have been discharged. But importantly, do we know who they are, their identities? Have they been able, as the health authorities, to reach out to their next of kin, their families, all of these people who are in the health facilities? Those are the questions that the minister will have to field from this contingency of media people who are outside, within, I must say, within the Helen Joseph Hospital. However, we are not allowed yet inside the wards.
Thank you very much, Moloko Moloto, on the ground there at the Helen Joseph Hospital, and we'll keep touch with him. We'll connect with him a little bit later as the minister's visit progresses.